Chair, thanks the gentleman. Gentleman yields back. Chair recognizes the gentleman from Pennsylvania, Mr. Murphy. 5 minutes for questions, please.
Thank you, doctors. It's good to have you here. Appreciate this. I want to pivot a little bit here to talk about piecing together post-market and pre-market analysis to look at this, and in particular, a couple of devices used in women's health care. One is called a Morcellator. Are you familiar with the Morcellator? A device that is supposed to shred tumors, et cetera, but has been associated with complications in women in terms of actually spreading cancer for them. Now, it's been on the market for 20 plus years, and the FDA admitted for the first time it became aware of the safety issue with power morcellators was after December of 2013, correspondence from a physician citing the case of a family member. This is someone who had just recently had another surgery to remove another recurrence of cancer that was spread by the morcellator. The manufacturer was apparently aware of the dangers of this device as early as 2006 based upon a report from Dr. Lampert, or a pathologist from central Pennsylvania, who cited about 1 out of 300 samples of morcellated tissue from his hospital had evidence of a hidden cancer, which was morcellated. So my question is, did the FDA have any evidence of these dangers in 2006 or prior to that? Are you aware of this problem?
So in the past, the thought was that what risks of cancer there may be for a fibroma, for a fibroid to actually have cancer in there, were significantly less. And one of the things when we looked into it more recently, we came to a different conclusion, that the likelihood of cancer is higher. There's still disagreement in the community because, as you know, the healthcare professional societies disagree. They think we have overestimated the risk of cancer. We said we have a different perspective, and that's why we went out and we put contraindications and warnings on the use of that device, that it should only be used in a more limited set, or offered as an option in a limited set of women, and think about primarily women who, in the absence of using the device, would no longer be able to bear children, but they want to bear children. And we felt those cases, the risk of the cancer is very low. They should have the opportunity to weigh in, but we scaled back dramatically how that should be.
So this is a case where the science available at the pre-market analysis has changed. And once it's being used and the data, you have a mechanism to go forward on this and make some changes. Let me ask another question. Brigham and Women's Hospital was aware of the dangers in 2012. A patient by the name of Mrs. Erica Katz was seriously injured in 2012 by the device and then died in 2013, according to reports. I wonder, do you know if that hospital reported that to the FDA? Would you know?
I'm not aware that...
Is there a mechanism where the hospital is supposed to report that, or the manufacturer is supposed to report that, so you can do the analysis?
Yeah, so user facilities have certain requirements for reporting. So do manufacturers if they become aware of certain events. And what I can tell you is we've been looking into those concerns that have been raised regarding reporting.
Okay. In a response to congressional inquiries about this, the FDA admitted that the 1 out of 350 risk does not address other types of malignancies, which you would add to that risk, you said. They went on to say the FDA also identified studies showing that morcellated patients had worse outcomes than patients who had not undergone morcellation. So this is more than just the issue with just a fibroid or if it's cancerous. It's also a question of outcomes. Is this something that the FDA is reviewing also with regard to their stamp of approval on these things in terms of the outcome measures?
So in terms of the tests we've looked at, we think where we have constrained it right now is for use is where the benefits outweigh the risk, but we are continuing to look at new data as it arises, and if so, we will act accordingly.
Thank you. There's another issue in women's health that's brought to my attention. It's a product called Essure. It's a permanent birth control device that went through FDA's rigorous pre-market approval process, yet despite getting the agency's approval, it's been linked to at least 4 deaths and deaths of 5 unborn children. Apparently, a total of 24,000 women have come forward claiming that they have been harmed by this device. And so the question is, well, how it remains on the market with the potential for problems. And because this has the FDA stamp of approval, these women feel at this point they cannot take their cases forward, and they feel they don't have any recourse. Is the FDA also reviewing this issue as well, as far as
we are, in fact, we held an advisory committee meeting a few weeks ago at our behest to give an opportunity to put what new evidence is on the table, to assure that people who wanted to raise concerns about it had an opportunity to provide those concerns. And we are now currently reviewing the feedback we received from the advisory committee, as well as what we have heard from other people, as well as the state of the evidence, and we will come out with our conclusions on that to the public.
Thank you. And as this goes through, since this hearing's been a lot about pre-market analysis, what this comes down to is I just want to make sure that we are aware of what mechanism you have, because I understand the science of 1996 is different from the science of 2015 and our knowledge base, but to have an ongoing mechanism for review and changes of devices and getting information there and looking at those things. I mean, I'm glad you had some hearings on this, but I'd certainly like to know that that's part of the system. As I'm out of time, I look forward to hearing your comments on that in the future. Thank you.